Welcome to another edition of the Onward Ozarks program brought to you by the Northwest Arkansas Council. I'm Randy Wilburn, host of the I Am Northwest Arkansas podcast, and I'm excited to guide today's discussion on one of the most important topics impacting our region, healthcare. Healthcare is one of the most pressing and complex challenges for any community, and Northwest Arkansas is no exception. Today, we'll explore where we stand in our journey to become a healthcare destination. And we'll hear insights from Paul Umbach, Stefanie Pawluk, and John Findley, experts who have been instrumental in shaping and evaluating our progress. Let's begin with some foundational background. In 2019, the Northwest Arkansas Council brought in Paul and his team at Trip Umbach to assess our region's healthcare landscape. Their evaluation resulted in key recommendations. We needed more medical specialists, expanded graduate medical education, and most importantly, a medical school in Northwest Arkansas. As Paul explained at the time, physicians who complete residencies locally are highly likely to practice within 70 miles of their training, a significant benefit for Northwest Arkansas and its surrounding communities. Another critical finding revealed that our region was losing nearly $950 million annually as residents sought health care outside Northwest Arkansas. By retaining more of those dollars and expanding local services, we could make a profound economic impact. Fast forward to today, Paul, Stefanie, and John are here to share an update on the progress we've made toward those goals and where we still need to focus our efforts because the job is certainly not done. Paul, I want to start with you. While there have been meaningful successes, there's still a great deal of work to do as our region approaches a population of 1 million, which I can't believe every time I say it. What do you see as our biggest opportunities and challenges ahead?
Well, thank you, Randy. I think, first of all, you're on the right track because 5 years ago or 6 years ago, a group got together through the Northwest Arkansas Council and developed a process whereby a variety of different organizations and entities can work together. So the ecosystem of healthcare in Northwest Arkansas has already gathered, and they've been gathering for years. They actually worked together during COVID. And I think the best opportunity is to continue that engagement, but also to continue to focus on some priority areas. And three things did happen since the last study. The first thing was a 35% growth in graduate medical education, which you had mentioned. The second thing was there was a reduction in the outmigration from about 950 million. There was $250 million improvement. So now we're just under 700 million leaving the area. And the third thing that happened was some transformational projects like the LSL Walton School of Medicine, the development of the Whole Health Institute, and many other projects totaling about $500 million in economic development. So you're on the right track. I've worked with 500 communities over the last 40 years, and many haven't even started to bring these players together. So you already have a history of working together.
Yeah. Well, I mean, certainly it helps to have the resources that we have in our backyard, right? And so certainly we have been able to lean on that. And I tell people all the time, that's one of the things I think that makes Northwest Arkansas so special is the access to resources that we have that a lot of communities, quite honestly, just don't have. And so there is some tremendous benefit to that.
That's correct. And I will also say that having the foundations and the large corporations and all of the entities gives you an advantage, but it can also be a challenge to make sure we're all pulling together. And one of the great things about any community that's successful is how the people work together. Organizations really can't work together. They're just pieces of paper that are filed at some courthouse somewhere. Entities aren't able to do anything together, but it's the people in those places that connect. And it's that um, energy that has really propelled this project forward this time. Now, these people in a place with a purpose are using a lot of passion. So, a lot of P words there to get this thing moving.
Well, I think it's important. I mean, it is about flesh and blood, right? It is people that are going to do this. I tell people all the time that AI is not going to soon replace us that quickly. We still need we all need to come together and collaborate the way that the three of you are. And so that
Mhm.
leads me to the next person that I want to bring on and kind of introduce. But before I do that, just a little bit of housekeeping for all of you here. We have a ton of folks on this webinar today, and certainly everyone at the council really appreciates that. This program has been something that we have done for the past couple of years now, and I'm just amazed at the life that this program has had and the conversations that start because of it. And that's the whole purpose of being here. So I want to give you some homework today, even before we get through all of this, is to really be thinking about the questions that you have. There'll be an opportunity for you to ask some of those questions here online. We may not get to all of them, but trust me when I say this, that we're going to have a very robust conversation in the 1 hour that we do have. We want to be respectful of your time, and we want to make sure that you walk away with some information that maybe you didn't have before. And so I really appreciate you guys taking the time. And then I want to mention one other thing, especially for those of you that registered for this, that you are eligible for a $100 gift card from Walmart. Our neighbors right up the street there from me here in Fayetteville. And so we have 4 gift cards to give away today. So throughout this presentation, I will take a quick pause for the cause, and we will give away those gift cards to make sure that some lucky viewers of this webinar get to partake in that. And certainly we appreciate you well in advance. And without further ado, I want to welcome Stefanie Pawluk, who is the newest executive director of the council's healthcare transformation division, and someone stepping into this role to help implement this 2030 roadmap. And so, Stefanie, I want to ask you, what excites you most about the region's vision for healthcare transformation?
Sure. Thanks, Randy. You know, I think Paul, you started set up the stage perfectly. This region is pretty unique in that we have a group of healthcare leaders who come together on a regular basis to collaborate and think through and plan for the regional needs. I can't think of a small regional ecosystem of leaders that do that anywhere else in the country. I think it happens a lot at state levels, but states are so different in how they approach healthcare issues. And I think when we think about how quickly this region is growing, the fact that this group of healthcare leaders across this ecosystem come together on such a regular basis, they formed just in time right before the COVID pandemic hit, and they were able to come together and have this known relationship with each other to kind of step in during that crisis and sort things out and figure out the right, distribution of resources and figure out the needs of the community at that time. And I think that continues with this roadmap ahead from Paul's organization and sort of laying out the needs as we think about getting to 1 million people here. And I can't think of something more personal of an experience than your healthcare experience when you're thinking about, joining one of our amazing companies in the region and joining them as a new employee and either relocating yourself or your family to a region. You don't want healthcare and sort of the question mark around what may be available to you in the region to be something that holds you back from making that change and joining this wonderful community. So I'm really excited to be able to be part of this group and really look forward to sort of finding the next right thing for the group to work on and really make some progress in the region.
Yeah, well, certainly no pressure. We only got 5 years, right? So,
Right.
but no, I mean, you are among friends, and certainly with your background and credentials, I'm expecting some really excellent outcomes for your division and for your group. And so, I just we're glad you're here. So I'll leave it at that.
Thanks.
So listen, I want to introduce our last panelist that's here, John Findley. John, why don't you just quickly introduce yourself, and then I have a question for you.
You bet, Randy. It's so excited to be here, and I certainly appreciate the opportunity. My name is John Findley. I'm the Chief Medical Officer at the Heartland Whole Health Institute, a family physician by training. but have spent the bulk of my 25 years in value-based and whole person care. So really excited to be able to contribute.
Oh, that's awesome. That's awesome. So I want to ask you this question because this is certainly right up your alley. The Alice L. Walton School of Medicine is poised to be a game changer for Northwest Arkansas. I have told so many people about this. The fact that she's starting a school here, it's almost in the process of rolling out, and I'm just curious to know from your perspective as a medical practitioner here in Northwest Arkansas, how do you see it reshaping the region's healthcare workforce and research capabilities?
Absolutely. I think it really is a unique opportunity to break the mold per se. Doctors and their training in those formative years really do create habits that greatly impact the way they view patient care. With our really unique curriculum focused on not just prevention and disease reversal, but making sure patients have equitable access to care, I really do believe we're defining a new generation of physicians that are coming out as new graduates that are ready to approach care differently. That dovetails nicely, of course, with the work that's happening with both Mercy and Cleveland Clinic. Is that I'm excited to be able to bring new talent to the region. They can be trained in the ways that are more empathetic and connected to what matter most to patients, but then to have an ongoing level of opportunities in specialty care for both residency training at our various health systems across the region. And hopefully the goal there is to keep more and more of those new graduates in our region and really looking out to the rest of the state to make sure we can serve that greater good in our rural communities.
Yeah.
Mhm.
I think, were you going to say something, Paul?
I was just going to say that one of the things that's so important is that we look at this as a regional project,
Mhm.
and that while health outcomes are challenging and the payment and reimbursement is a huge issue, and you'll see in the report many, many issues, I feel that having a regional game plan is the only way to do it. Because if you look too far to the national situation, you'll get depressed pretty quick. And I just wanted to say that the committed leaders that are in place have been there the whole time. And while we have a relatively new team with Stefanie leading, she's not new to the region. John is bringing fresh new energy into the region. There's three groups. There's newcomers, there's old timers,
Mhm.
and there's comebackers. And I feel that the right mix is in place. And really to say we're not trying to make healthcare in general in the United States better. We're actually trying to make it better here and then have this be a model for the
Yeah.
rest of the country. And that is so transformational. And I think everybody believes that very, very strongly that we can do that and be a model for value-based care and value-based payments and healthcare outcomes and workforce into the mid 20th century. Actually, we're getting closer to 2050 than we are to 2000, if you do
Mhm.
the math.
Yeah. I mean, that is exciting. I think that and and in a little bit where I'm going to come back to John because I do want to dive a little deeper into the whole concept of whole healthcare, right? I think that's it. That is something that we need to talk about, and it's something that I have emphasized even while I don't have all of the language for it. I think it's important that even us lay people have an understanding of what is coming and what could be expected because I think it formulates how we look at the place that we call home.
Yeah.
So yeah, it makes a big difference. Stefanie, I want to ask you, the 2024 healthcare report outlines significant advancements since 2018, but it also highlights substantial challenges. And I know that um, one of the conversations that we had before we did this recording was that it was implied and also reminded that we're not out of the woods yet. We have a ways to go to get to where we need to be. So it's not a this is, as I always like to say to people, we have to play the long game on this. But we all have to be moving in concert in one direction, and that direction is, what is a successful outcome healthcare wise here in Northwest Arkansas. But I want to ask you, from your perspectives, what do you view as the most pressing issue that must be addressed to achieve the 2030 roadmap?
Mhm. Sure. So Just to highlight sort of what the key recommendations were as a whole from the report. There's this focus on the whole person care piece, which I know John will be perfectly teed up to address after this. But reimbursement and sort of how you finance healthcare and how that's connected to value-based care is sort of one bucket. The other piece is making sure that we have the right workforce for a growing region, just not keeping pace with the people who are retiring and leaving the healthcare workforce for one reason or another. Thinking about how we as a region and our healthcare organizations come together in research and collaboration, and sort of making sure we're an innovative group on the healthcare research side. And then again, continuing to nick away at that specialty care piece that's leaving the region. So those are sort of the big bucketed areas from the recommendations of the report. And to me, when it comes to thinking about what the number one priority is, I think it's just really important to realize how connected all of those things are. You can't spend the time to focus on value-based care if we don't have the right reimbursement model in place. If providers are currently being underpaid from a reduced reimbursement model, they're focused on the pressures of sort of paying their current staff, and making sure that they're seeing the current population base that they are, and they can't focus their energy on transforming into a new care model. If they don't have the right workforce to do that work, it's the same issue. And so they're all really interwoven. So when we come together as a group, I think we really need to talk about, what's the current state happening at all of our different healthcare organizations. And when we think about this roadmap, what can we, tackle first to help us get to all of those things? And I know that the value-based care piece and reimbursement is a big one. And it's definitely multi-year, multi-stakeholder effort. So I think that, the work is cut out for us. I think it's all things that our organizations are working on in different ways. And just being able to have a roadmap come together for our region as a group is going to be really important to addressing all of those things.
Yeah. I mean, there's so many different parties coming together to work towards the same goals. So, Paul, can you just piggyback on what Stefanie just shared and speak to that collaborative effort and how you guys see that at Trip Umbach?
Well, one of the things that's really important to get in everybody's mind, especially all the viewers and participants, and I thank you for joining, is just making it bigger, because bigger hasn't worked. We have $5 trillion go to healthcare. We have the worst health system. We have the worst health outcomes. We have the lowest life expectancy of all the developed countries. You know the problem. The problem is we spend a lot and get very little. So I don't want anyone watching this thinking that one of the goals is to grow the old healthcare systems and payment models. This is really the opposite. This is about finding a way for people to be healthier and spend less on healthcare. This is a way to provide more access to prevention and wellness. This is a plan to really make healthcare work for the economy, but also for the people, for the employers that have productive folks that can go to work and work hard, for communities that have the resources they need. So this is more of a cheetah than a dinosaur. And one of the things I like about Northwest Arkansas is it never had that as much of that old model. It wasn't gifted at one point with a large academic medical center, university, hospital, teaching center. It was actually given pieces. And now we have the chance with John's leadership and Stefanie's and others to pull these things together to create something really different for mid-century. And I feel that from what I'm finding is that we're all ready for a new model where the economic design of healthcare can actually lead to health and a better, stronger community, but not coming in and building a brand new tower of this and a tower of that and leaving people out in the cold without good healthcare. This is the time and the place to do that with the resources and assets that the community has. It's one big chance to really change the game, create a cheetah that can survive in anything and be fast and nimble. I think
Yeah.
that's what John and I have been talking about in Stephanie.
Yeah. John, you want to add to that?
No, I love it. And I think to follow both what Stefanie and Paul said, we really are uniquely positioned. And I might just add an additional perspective that as you think about value-based care is one of those words in my mind that's maybe become a bit stale. And I think we need to, I mean, we've have so many levels of commitment in Northwest Arkansas. It's what brought me here. Now it's really sort of defining those lanes. What can we do in novel alternative payment models where we really do change the way physicians are paid to incent and reward good care? How do we
Yeah.
work together collaboratively to address? I mean, we have to have policies in place that increase the base reimbursement, with Arkansas being one of the lowest reimbursed states in the country. To just underscore what Stephanie said, I'm a family medicine physician and margins are tight. So our ability to innovate is greatly hindered by reimbursement that's below where it needs to be. And that's coupled with us being here in the southwest part of our southeast part of the country, which has some of the highest disease burden when you look at obesity, diabetes, hypertension, et cetera. So as we at Heartland Whole Health are thinking about this is how do we entertain alternative payment models across all payer environments with a very keen focus on the employer-sponsored insurance space? We're very unique in that we have so many national brands that are all housed here. Employer sponsored insurance represents over 50%, roughly 50% of all Americans' health insurance coverage. So they've done everything they can to offset costs, but the reality is that in the daily consumer's life, premiums and the cost of care are a huge barrier. So looking at alternative payments, looking at policy, working with these incredible health systems for advanced delivery models. And then again, we can come back to how is whole person care different. But really appreciate the opportunity to work with Stephanie and all the individuals in this region that are contributing to this.
Yeah, no, and you're absolutely right, and there's so much that can be done, and as they say, an ounce of prevention goes a long way. So,
Yeah.
it's
Not
how we take advantage of that. Paul, I want to ask you, and this is one of the things that I think caught my eye the most, and this is actually something that I've talked to people about. I mean, I think there are people on this webinar that have had friends and family members that have had to go elsewhere for medical care. Okay. I mean, I know specifically some young people that I had spent time with that had to go down to Houston and up to the Mayo Clinic and some other places. And so I would love for you just to kind of highlight the about the fact of the significant reduction in healthcare outmigration since 2018. What strategies or initiatives have been most effective, and where do you see room for further improvement? So we've seen almost $250 million in savings in terms of money staying here in Northwest Arkansas versus leaving. How do we double that?
Well, I think it first starts with why do people have to go out of their community for healthcare? We just start with that. Well, there's a couple things. One is that there's not a healthcare provider who can provide the service you need in the area you live, and you have to go somewhere else. And that's just a basic supply and demand. There's not enough physicians. I need to go and find one in another place. The more challenging issues really come from, is there the kind of specialty care in the hospitals and physician environment that I'm in? And that means that if I need something very rare or something like a transplant or something like burn care, if I'm in an emergency situation, it would take me to a large trauma center. And for some of the things, it's really that there's just not an awareness that it is even available. And you think, well, if I need this, I got to go to St. Louis to Barnes Jewish, I got to go to Baylor, I have to head to the Mayo Clinic. And for certain subspecialties, there's this sense that we don't even know what's in the region. Third part is really difficult, and that is quality. Is the quality of care in my region, Northwest Arkansas, going to be the same or better at these national centers? And some of that's subjective, and some of that's quantitative, and some of that's based on metrics that employers and insurance companies use to make sure that people get to the place that does the most hearts or the most cancer treatment. So we have some national players like NB Anderson, we have the Mayo Clinic, we have the Cleveland Clinic for Heart, and these are all the dynamics. One thing that's really, really important to understand, though, is that number, we're only seeing half of it when we think about the out migration. Here's the other part. In migration, how many people from neighboring states come to Northwest Arkansas for care? Well, we found in our data this time that the percentage of people leaving went down, but there wasn't much of an increase in people from the outside coming in, except for in pediatric care. So over the last period of time, Children's Hospital developed a Northwest Children's Hospital. Well, the data was shockingly positive in that it kept most of the children that were going to Little Rock or to other children's hospitals in Northwest Arkansas, but it did something even more amazing. It brought folks from Kansas, Missouri, and Oklahoma for care. So they actually kept more people from the outside as much as they kept from the inside. So we kind of have to think about out-migration as really a formula of how much is coming in and how much is going out. So some of the places we've worked, and we've done this same project in 50 places, you'll see that over time, Spokane, Washington, for instance, now gets more patients that come in than leave. So they're a bigger than they should be place. There are other places around the country that have done really well in really growing the service line so that they become destinations for healthcare. And when you're a destination for healthcare, you're also doing a good job keeping everybody in your community cared for in your region. So other places that we've been working have started new medical schools like Northwest Arkansas. They've started to have a bigger catchment area for care. Evansville, Indiana is a peer community that now has more people coming in from the surrounding area that went out, and they have big players around them. If you're in Evansville, you can go to Vanderbilt, you can go to WashU in St. Louis, you can go to Indianapolis. You got a lot of choices, but they're actually keeping more patients than they're losing now. So over time, these are we have to, and the big part of this is the physician capabilities on the specialty care. If you only have primary care, that's incredibly good until you need specialty care, and then you have to leave the region. With you comes dollars that are left from the region that should be there. And when no one comes, no one's bringing fresh dollars in. So this is what the Mercy partnership with Cleveland Clinic, this is what Washington Regional has been working on. This is what the Alice L. Wharton School of Medicine will try to address, is really to get to at least an even state. So we believe that by 2040, and that sounds like a long way away, but it's only 1 week and 15 years from now. 2040 is the same distance in time as 2010.
Yes,
So guess
exactly.
what, my friends? We can do it, and we can get to parity by 2040, but we won't get to parity by next year because it took a while, but we were moving in the right direction. I hope that's helpful to kind of just break it down. Why do people leave for care? Well, quality and access, and also the availability of the providers and the services, but we're moving in the direction of addressing that.
Yeah, and I want to just take a quick pause with that, and then we're going to come right back to you guys because I actually have a follow-up question to that. I want to say that we have two winners, two $100 gift card winners. One is Melissa Breedlove, and the other is Philip Sambol. If you guys could acknowledge by just raising your hand and saying here, I believe you are here, you're registered, and you're physically in the presentation. So I want to congratulate you both, Melissa Breedlove and Philip Sambol, for both getting a $100 gift card from Walmart. And we certainly appreciate you guys being here and participating in this healthy conversation. Now, one thing I want to mention, and I think it certainly bears repeating. I think sometimes people forget, but even just one professional doctor makes a huge difference economically here in Northwest Arkansas. And so a lot of times we think, oh yeah, we just need some more doctors, but having more doctors and having more specialty professionals, that also means more staff, It means other paraprofessionals that work alongside these healthcare professionals, and it has a tremendous effect economically and on the bottom line of a community. So the investment of time and effort that we're putting into trying to solve some of these problems really will have a long-term effect here in Northwest Arkansas, just by being a significant boost in the economy.
Mhm.
Stephanie,
Absolutely.
you want to add something to that?
No, no, I think you're right. And I think that healthcare as a sector as a whole, in terms of its economic impact on our region, is huge. And pulling back that piece of out-migration that Paul was talking about, and having people come in from other states now, for in the example of the Children's Hospital, it just goes to show the potential if we're able to chip away at the different goals of the report.
Yeah,
The
yeah,
healthcare market, when we studied it last time, was underperforming pretty dramatically. It was about $2.5 billion was the healthcare market in Northwest Arkansas. It's grown to about 3.6 billion. It grew twice as fast as the regional economy grew during that same period. And the regional economy didn't do bad during that period. Healthcare in Northwest Arkansas doubled in its pace of growth over the last 5 years. And we project that to continue to have a $6 billion healthcare delivery system. So Northwest Arkansas is starting to see the economic benefit. And all you have to do is do what I did a year ago, and that's drive down I-49 from the new stretch in Missouri, which, thank you, made my trip 20 minutes faster now because I don't have to stop at a stoplight. And when I'm coming from Kansas City, all I see all the way to Fayetteville is big investment after big investment. And we're also seeing on the numbers that you're closing the gap on the percentage of the healthcare industry that's part of the whole economy, but you're not there yet. And I think
yeah,
that's one of the themes of this talk today is we're moving the needle, but the needle has to continue to move, and the Healthcare Transformation Committee has to continue to push, and there has to be action, or we could slide back because other markets are growing too, and healthcare is something that has to be there. And if it's not there, it's not good for quality of life or for business or for the overall economy.
yeah. And just to add to that, one of the questions that came up, and the individual was asking essentially, have you considered thinking outside the box when it comes to collaboration partners outside of the healthcare arena, right? So they're talking about like bankers,
Yep.
realtors, CPAs, attorneys, because they said typically the first thing a physician needs when coming to Northwest Arkansas is a home, which means they
Yep.
need a realtor, mortgage lender, local banker. They might need somebody, a good competent attorney for compensation and benefits review, a CPA,
Mhm.
trust officer for estate and tax planning. I mean, there's just a ripple effect of other
Right.
needs that come into play outside of even just the healthcare arena.
Yeah, definitely.
Yeah.
Absolutely.
So, John, I want to get back to you because I think you hold some of the keys of what's possible, right? When we start talking about this whole concept of whole health, and so I would love for you to kind of talk about a little bit about value-based care and how do you see this approach shaping the future of healthcare delivery in Northwest Arkansas?
You bet. I mean, I think the two topics there are inextricably intertwined, but really a path to value from the whole person perspective. I might start there is really rethinking the way we approach the patient at the bedside. We've all grown up in a sort of an acute care, sick care model as we know it. And I think where we have the opportunity to truly be unique is in our using Cleveland Clinic and Mercy as an example. We certainly strive in our setting now to have world-class specialty care, starting with cardiovascular care. But I think more important is a shift in the focus to a path not only to excellent disease management, but disease reversal. And whole
Mhm.
person care really is about looking about food as medicine, mind as medicine, and movement as medicine. And then doing that in the context of a delivery system that really gives that patient access to what they need as the unique individual that they may be. So whole person principles, really, we've talked about this for years, But putting that to practice, I think, is going to be, again, one of our biggest challenges and one of the biggest opportunities on the table here. Um, the value component, the tsunami of chronic disease that's hitting our country right now, is really part of this value proposition. So all of our work with both health systems, the providers, and the payers is to acknowledge how do we compensate fairly for the infrastructure it takes to get people access to a nutritionist, to community health workers, to social workers as an extension of the team. The traditional delivery model, with fairness to my peer group, is too physician centric. And we have a payment model that's built entirely around that. So part of what we're trying to do in every different domain is sort of challenge that status quo. How do you make sure that all of the staff, Randy, maybe to one of your earlier comments, all of the people that contribute to the health and well-being of that patient are part of the economic picture and the profile that we're trying to sort of solve? Does that answer your question, Randy? Or
It definitely does answer my question. As when I first heard about the Whole Health Institute, I mean, just when I hear the words whole health, right? You think about just what that encompasses and why I think it's important for us to look at the whole person and how we can just improve our lives. And I a long time ago I did a podcast episode about blue zones, and I know there's been talk about whether or not those are real things or not. And but there are some specific factors that you can look into, and there was even talk about whether Northwest Arkansas could potentially be a blue zone for some of the aspects that make this such a special place. I mean, we spend a lot of time outdoors. We have a high, an inordinate amount of days of sunshine, even today. So there's a lot that plays into what makes this area so special. I mean, we've got this region has more places to hike, more places to bike ride, and more places to commune in the outdoors, which I think has a tremendous impact and effect on the bottom line of our health, our overall health. And so I'm just curious to know from that perspective, what are you guys hoping to lean into to get the wider community to kind of buy into what we're all talking about right here, right? Because you guys are all professionals.
Yeah.
And you do this day in and day out. But for the average Joe or Jane like myself, where, yeah, of course I'm concerned about my health, but it's like, how do I make sense of all this so that I can then communicate that both to my family and to those in my community around me to encourage them that, hey, better times are coming soon. And even still, there are opportunities right now for you to take advantage and have improved healthcare.
Absolutely. A guiding mantra I've used in my practice, and it's one we're looking for here. I actually just came away from a design meeting this morning as we think about cardiovascular services is sadly for most of us, it's not till the big one happens that you really have that critical moment where you say, gosh, maybe I need to make a change. So what I'm most excited about is we really are designing from the ground up, not only medical students and healthcare campuses in partnership with others in the community, but we're really thinking about at that point of care, how do you get that patient the resources they need to do three things: improve awareness of the impact of their choices day to day, give them meaningful action plans. So here's the things you can do. Here's the resources in your community. Here's the things that are readily available to you. And then ultimately that third A is accountability. And I think we're going to have to work together. So how do we create some level of accountability from a payer standpoint and a provider standpoint? It's a bit of a game potato in healthcare where everyone sort of does their best when they have that person in front of them. But I think with the spirited tone of partnership in the air here, we really do have the chance to work together to improve awareness, create meaningful action plans embedded in our communities, and then really hold each other accountable, Randy, to making sure that everybody has equitable access to those resources. There's very real barriers in rural Arkansas.
Yeah.
You and I are, we're very privileged here in many regards in the northwest corner of the state. Everything we're doing is with a lens, sort of a hub and spoke model. How do we make sure we're improving primary care delivery in rural environments and making sure that patients in the entire state have access to everything you've just described?
I
Yeah.
want
I
to
mean,
say,
go ahead, Paul.
I just want to say that it's really bringing these things together that's so important. In my next year will be my 40th year out in the wild as a consultant.
Mhm.
40 years is a long time. And I think in the early days, everything was so bifurcated and cut up. Like, for example, we started this thing called community health needs assessments in the late 80s and early 90s. Meanwhile, while we're doing community health needs assessments in places like Northwest Arkansas, we were working with hospitals and they were trying to find out how they could beat the competitor on different product and service lines. Meanwhile, we were working with health insurance companies all over the country, and they were trying to get the best margin they could for the services and grow their market share. Meanwhile, later, we've now been involved with 40 medical schools, and I was very happy to say I've helped Alice and others with the current medical school. All of these things in my career were all going on at the same time. And then there was this economic development part of what the consulting, and we had people saying, we want to grow the economics of healthcare. And what I just realized about a year ago was whole person care is sort of like whole community care. And a community health assessment is really part of a whole person assessment times a million people. So maybe one of the things we can do is start gluing some of this together. And I think having the payers, the providers, the employers, but I'm going to reach out to everybody that's on this call. Every single person is part of this ecosystem. Just by joining today, you're in the conversation, no matter what you do. And I think it's gluing these things together, which is going to be the number one thing we can do to make the community healthy. But what is a healthy community? It's a million healthy people.
Yeah. Yeah, absolutely. Yeah. And actually, a couple of people had asked questions along those lines, including Katie Cascamo, who said, how do patient leaders in Northwest Arkansas foster collaboration and build consensus among healthcare providers, industry leaders, researchers, and patient communities to co-lead meaningful health system changes? And you just alluded to that. So I mean, I think we're on the right path. And I'm constantly reminded, like when I walk around in the streets sometimes and people say, "Oh, I saw you on Onward Ozarks. Thanks for talking about that topic." And they always come back to some of the same topics that really resonate with them, which I think resonate with everybody, right? And the council has been at the forefront of making sure that these are top of mind. And the first one is food security or food insecurity. The second one is housing availability or affordability. And obviously one of the most important things, because none of these two matter if we don't have health, if we're not healthy, right? And actually a couple of them they're all kind of linked together. And I think it's important for us to understand why these conversations are so important to have, and why we need to be talking about this early and often. So, Stefanie, I have another question for you that I want to ask you, and it's certainly in your new role. How do you see the recommendations in this report aligning with the unique needs and expectations of Northwest Arkansas residents,
Mhm.
right? Because that speaks specifically to where people are in their current state.
Yep. No, I think that's right. So I think we have a unique environment in that our employers are heavily engaged in the healthcare space. They're thinking about their employees and associates and what, is best in class that they can offer to them. And then those people live here. So I think that when you think about whole person care and sort of the value-based piece that John laid out, I think that the employers themselves are going to be very much involved in this conversation and making sure that they're able to bring together the right offerings to help the people that live in the region that they employ. And then an interesting angle from the report, I was thinking about the report and some of the unique pieces and recommendations and sort of maybe the areas that we have some gaps, and coming back to like level 1 trauma as an example. When you think about this outdoors ecosystem, economy that we have, our recreation economy here, and our efforts to draw in so many outdoor events. And if we don't have a level 1 trauma center, like I wonder, will that deter things in the future? I think it's a value add to grow out healthcare service lines when you think about some of these other pieces of our economy and the different parts of the things we love about Northwest Arkansas. So that was kind of one that I was like, yeah, we probably need one of those, especially if we want to keep growing in this space. And
Mhm.
just our neighbors who may be out on the trails or doing something, trying to think about the different healthcare needs, even from that lens. I think the report kind of shone a light on some of those things that, other communities have, or, people are being transported for certain things. And if we can just have that in part of our backyard, that helps, the appeal of our destination region.
It does. And I think sometimes people think that regular folks like myself don't think about those things. But I was literally just in a tire store a week ago, and a guy brought that up to me, and I was like, seems kind of random, but he was talking specifically about level 1 trauma care
Yeah.
in Northwest Arkansas. And, he was talking about, I can't wait to the day when Northwest Arkansas has the same type of specialist that I might need to see in Fayetteville and in Bentonville.
Yeah.
Whereas I don't have to drive to Bentonville or Bella Vista to go see this specialist. I can see them right in my hometown.
Yeah.
Mhm.
And these are things you take for granted, right? When I lived in the Boston area for 17 plus years, I mean, Boston has an embarrassment of medical riches when it comes to hospitals and just access.
Yeah.
And I think that makes a huge difference.
Yeah, Randy, I might just add to that. I practiced and have functioned mostly in rural environments for the majority of my career, and I think to sort of follow up your point there, it's the infrastructure that it's going to take to really make sure we can expand and improve access. What I appreciate about Alice Walton and her vision for improving access to the arts is how do we improve equitable access to healthcare? The virtual front door is sort of a new social determinant or barrier to care. So as we think about this, really critically assessing, how do we make sure that everybody can access a specialist virtually, either from their home or from their rural family medicine doctor's office, and vice versa. So we're really committed to trying to think about that equity piece, because equity, again, in NWA is very different than in the southeast corner of the state. Housing, you mentioned, housing and transportation, those are very real barriers. I think we can work together to come up with some very meaningful solutions by really broadening that virtual front door in everything that we do. And again, that goes back to policies that pay for it, and payment procedures, and the infrastructure to get that done. Just wanted to make that point.
Yeah, no, I appreciate that. Thank you for that. So real quickly, before we go on to the last few questions that we have for the last quarter of this conversation, I do want to welcome Julie Harlan and Brenda Hernandez. You are the next two $100 Walmart gift certificate winners. And so certainly we had asked you that you raise your hand, and some of the folks on the team will acknowledge that. And we see that you're here, and certainly we'll make sure that we get your information so we can get that gift certificate for you. Christmas is just a few days away. So for those of you that celebrate, it's definitely not too late to get some more gifts with those gift cards. So we hope you enjoy those. But again, that is Julie Harlan and Brenda Hernandez. Both of you are recipients of $100 gift cards. And so all in total, we have 4 gift cards that we've given out: Melissa Breedlove and Philip Sambo, and Julie Harlan and Brenda Hernandez. So thank you guys so much for participating. And for the other 200 plus folks that are out there on this call, we can't get everybody, but we appreciate you being here. And we hope, if nothing else, that the conversation that we're having is payment enough for your time on this webinar. So, Paul, I want to come back to you, and I want to ask you this question specifically. Graduate medical education has been a priority, with the goal of creating 200 residency positions by 2040. What are the critical steps Northwest Arkansas must take to scale its programs, and what lessons can be drawn from similar efforts in other regions that you've participated in?
Well, I think the first thing to keep in mind is there's a need for healthcare professionals at all levels. And one of the things that we identified is a workforce challenge. So when I say all levels, it's really from high school level programs, college level programs, master's level nursing and allied health programs, PTs, OTs, PAs, all the alphabets, and then also physicians. But the key part about graduate medical education that most people don't know is that you could have a medical school and keep hardly any of those graduates in the region unless they have a chance to practice and do their residency in that same area. And about 75% of all people do stay within 70 miles of where they do the residency. And I think you mentioned that earlier in the show. But keep in mind that if we get only too many physicians, we still don't get where we need to go. And I look at physicians like pilots, I look at all the other folks as like the flight crew. If I'm at the airport and I want to fly home in the middle of the night, I'm not just hoping a pilot shows up. One night I was there and there were 4 pilots standing over there talking. I said, "What's the problem?" They go, "No flight crew." Well, the flight crew would be like all the other people in the OR suite, and the plane won't get off the ground without those people. One of the things we found in this study was that the number of graduates with a master's and bachelor has not kept up. And in fact, over a 5-year period, we have fewer people coming out of Northwest Arkansas colleges and universities in healthcare than we did even 5 years ago, at a time when we need them so much more. So yes, we need more physicians, we need more specialists. There's something called a fellowship, which is later in your residency, where you become a subspecialist. We need those folks. But again, if we only solve this workforce problem with more physicians, we wouldn't solve it. So what happens when you don't have enough healthcare providers? Well, longer wait times. Eventually, you leave the market for care, or you don't get care and your healthcare status goes down. The other thing to keep in mind is that if we're not growing our own workforce, we have to buy it from the outside world at a lot more cost. So if there's no nurses that are being from Northwest Arkansas who want to stay in Northwest Arkansas, we got to pay a lot of money for nurses from outside to come. Well, guess what that means? We raise healthcare prices. The reimbursement is already terribly low. We create a situation where we're not sustainable. So I wanted to say that graduate medical education is super important, but we can't lose sight of all the other healthcare workers we need. And then the last thing I want to say about this is, for some reason, since COVID, pre-COVID and into COVID, people aren't as excited about getting into healthcare as they used to. At just the time that you have a bunch of people my age, I'm in that baby boom group. There's 70 million of us getting older and needing care. And the generation that's there to take care of us is saying, rather have a tech job at home, because I could just sit at home and look at my computer all day and make just as much money as being a PA or a nurse practitioner or a physician. Who would want to go be with people and have to take care of them when I can make just as much sitting and looking at my computer all day from wherever I want to be, Maui, wherever. So we have to find a way in the region to make health professions something that really connects to people. And that's going to be a huge thing that's probably not even in the report. Maybe a line or two about the fact that we need a pipeline and maybe a high school, junior high program. But let's face it, Randy, we don't have the people in the future to take care of people, we're in big trouble. The plane won't get off the ground unless everybody's ready to go.
Yeah. Yeah. You know,
Now I'm on the plane and I wanted to get off the ground, so I get care.
Yeah, you need all the help that you can get. So,
Yes.
John, can you follow up with that comment that Paul just made in terms of how are you encouraging the next generation, right? I'm there. I'm kind of encouraging my kids. I was just at NWAC last week on a tour, and we got to tour the space where they do the nursing program there at NWAC. They actually have beds at NWAC where if there was ever a major disaster, there's a spillover that they have an agreement with Mercy or I think it's Mercy, where they have beds available. And so there are opportunities for young people to get into the healthcare space. And I'm encouraging as many people as will listen to me that even though I'm not a doctor and I don't pretend to be one, that it is a great profession to be in. And I'm just curious to know, what are you sharing with the next generation along that message that Paul had just mentioned?
John, I think you're on mute.
Wow, I just had the best, most quotable moments there on that muted
Oh,
moment.
come on, get back to it.
Yeah, there are so many ways I can approach that, but really, I think it's getting from the starting blocks, getting them to appreciate the importance of team-based delivery models. My first dipped my toe into healthcare was as a phlebotomist. So I think the more we can encourage early workforce in those high school years, working with programs like Spark or other high school programs, I won't say that we've solved for that, but I think if we can get people to realize it really, as hard as it may be, is a noble profession. And I think getting our team to recognize that I always think about it as doctors are no longer mechanics. And we need to think about doctors as maestros. How do they work with a team of licensed individuals to improve access to care that's most meaningful to that patient? So I think that's a critical piece. You could be a community health worker. You could be a licensed clinical social worker. You could be a behavioral health therapist. One of the comments in the chain is we absolutely acknowledge the importance of behavioral health in this continuum and are really trying to look at how do we address that not only virtually, but in integrated delivery models like our federally qualified health centers and others do. I don't know if that's how you wanted that answered, Randy, but I think there's more than enough work to be done.
Yeah.
Physicians can only meet part of that need, and we recognize that.
Yeah,
Mhm.
and I think it's important for people here to recognize that there are a ton of programs that sometimes go unacknowledged. And so right here in Northwest Arkansas, so when people are parents or have younger people and trying to encourage them or what directions, as I tell my young kids, I have a 19, an 18, and a 14-year-old, I said, you're going to hopefully live a long life and that there are plenty of opportunities to try new things. And so I'm encouraging anyone that will listen to definitely look at all of the different areas of healthcare because, you could try different aspects of healthcare. You could try to go into different routes in healthcare. And so there are, we're all trying to get to the same place, but there may be a lot of different paths to get there. And everybody doesn't have to be a doctor either and can still do really, really well with that. So yes, no, you answered my question. And I mean, honestly, we only have 4 minutes left and there are so many questions that are hard to answer. I wanted to kind of give you guys some final thoughts. And Stefanie, I want to start with you since, you are going to be basically, even though John is here locally, you are going to be basically taking what Paul has unearthed and really running with it. And so we all have to be supporting you. But what are your thoughts as we kind of wind this conversation up for right now? And we're putting a comma on it. It's not a period. So
Right.
this conversation will continue beyond what we're saying, what we're talking about here at Onward Ozarks.
Oh, I think that's right. And I know like John and I will be talking next week about this and how do we, take the next step forward together. So, conversations like this get me really excited about the work ahead, and also recognition and appreciation for how big the task is ahead. And I think about things that trickle down to how do you get more people interested in healthcare? And it comes back to what you said, John, about, kind of bringing back the joy of practicing medicine and having the opportunity to be the maestro and not just the mechanic. So all those things are interrelated to each other. And I think that, I hope we have more conversations about healthcare in forums like this and can field some of these comments and questions from the community. And maybe we can think about ways to really tap into what the people of Northwest Arkansas are thinking about and needing from a healthcare standpoint while we still, shift the system and think about it with our employers and healthcare providers in the region. Just excited about the work ahead and not too scared of the challenge, although it is going to be a multi-year challenge.
It will be. Can some of our audience members, if they choose, can they reach out to you through the council website? Is that okay?
Yep,
Yeah,
absolutely.
I would encourage folks that are listening and have follow-up questions, things that we just can't touch upon, to please do that. And I know Paul earlier said that he was going to be connecting with folks because honestly, everybody that's here is part of Paul's tribe. I mean, you're the people that you guys actually care. You spent the time, an hour out of your day to hear this conversation. So I think it's really important. John, I'll let you go next, and then Paul gets the final word.
I love what Stephanie said, and I agree. We'll be working very closely. It makes me think of the idea of, many hands make light work. what's most important to us is how do we really look at a sustainable path forward. So I've really enjoyed this opportunity. I think that there's an ample amount of passion that's very purposeful and purpose driven. Now we just need to get into the brass tacks of what I would think is a much more precise and clear path forward, identify lanes, and at times have those tough conversations of who's doing what and why, but recognize there's more work than any of us could ever possibly do alone. So a spirited tone of collaboration with the community. I'd love for the questions coming in would offer the same. Please call me, reach out. The community has to be part of this design forward.
Yeah, absolutely. Absolutely. And Paul, you have the last word.
Well, I want to thank you, Randy, for bringing this topic to the forefront. Thank everybody for joining. Let you know that we don't have to be afraid to speak up and voice our personal opinions when we see something, say something. If you feel that the healthcare you're getting or the healthcare that's being provided, we're not like our grandparents and parents' generations where we were taught to just sit back and do whatever the doctor or the healthcare system or the employer or the payer tells us, but to advocate to make it better. So if somebody gets into a situation where you feel like you need to advocate, call us, advocate with us. This is the most personal plan you could ever implement, and having the chance to implement this plan with people that are really committed to it. So I look at this as a call to action to invite people to be part of this coalition. And Randy, thank you for being in a situation to invite the coalition to gather. And we're ready to engage because it's the people of Northwest Arkansas that have the most at stake for their health, not the organizations. So this
Yeah.
has to be people driven. So that's my final word.
Yeah, and I appreciate all three of you guys and the work that you're doing. And certainly you guys have been carrying a yeoman's task, if you will. And so I really just two things I want to say, and then then we're done because this has been an amazing conversation. I don't want anyone that's on this call to ever give up hope, right? Because that is, I mean, the sign of a great society is even those that lean in when things get tough. And we understand that things are getting tough. There are things we need to do at the federal level, but there are things that we can do at the state level to make the change that we so desperately seek in our community. And in this case, we're talking about Northwest Arkansas. And so, as in the immortal words of Alice Walton, we still have a long way to go. Please do not give up hope. Use this as a litmus test for the fact that our future does look bright. And with amazing individuals like Paul Umbach and Stefanie Pawluk and John Findley, we can certainly get there, as well as all of you that are on this call. So thanks for indulging me for 1 or 2 minutes over the call. But we certainly appreciate this. When this does come out on the Northwest Arkansas Council website, we ask that you share it with as many people as possible. Thank you so, so very much. Happy holidays to everyone and Happy New Year. And we'll see you in 2025 with a new Onward Ozarks episode. Peace.